Tommy, welcome.
Thanks, Jack. It's great to be with you. I appreciate it.
Great to have you here. Well, Tommy, we're 6 months into this thing. Help us figure this out. What insights do you have into the trends of companies returning to office?
Yeah, so I think a couple things. One, I think, first of all, on the COVID front, actually, just before I hopped on with you this morning, I had Tina Upson, our director that runs Crush the Curve in here. It's evolving every day, technology and the ability for us to do better surveillance and better testing. And maybe we can get into that a little bit in a bit. But I do think we're going to need to figure out how to stay at work and how to navigate the next year so that we don't have further disruptions. And I'm really proud of her and our team. We have this little team, but literally, Jack, they're working with Texas. This morning, we signed a contract with the city of Memphis, and we've figured out a way to do surveillance. And the issue is trying to lower costs for people, because even though if you're a restaurant or you're a business or you're a school or you're a dorm, whatever you are, you want to do the right thing and try to stay open, but you can't afford to test people frequently at $100 a test. And so actually just this morning, we came up with a new program where it'll be $4 a person to do surveillance testing. And we're going to launch that. But so the point is, it's always changing. COVID, there's so much information and misinformation out there. I think that there's a lot of polarization right now. We're in a presidential cycle that you got two sides using it as a political issue. And in the middle of it is science. And okay, where are we with it? How are we going to get through it? And probably for me as a physician, it's been a little frustrating to watch some of this happen, because, I think if it wouldn't have been a presidential election year, or we weren't so polarized as a country, this would have been seen more as a medical issue, right? You would have said, hey, here's the medical advice to get through this. But instead, masks have been politicized, orders from governments and CDC. So it's interesting. That's one side of what we'll talk about. But getting to your question, which is what's the future of work? I think we were all a little taken back when that stay-at-home order happened across the country last spring. None of us had ever seen anything like it. And immediately, I was really proud of the private sector. Like overnight for most companies, I know for your company, for our company, we quickly adapted. Everyone was at home on laptops, so we tried to stay productive. We spent a lot of time that first month saying, okay, how do we come out of the back end of this better? How do we continue to keep our corporate culture and motivate people? And then as a developer, we have thousands of square feet of space with tenants who all came to us and said, hey, we're going to shut down for a while. And can you help us? And what are we doing? And what should we be doing? And so I think there was this initial shock where everyone was at home. And now I do believe, Jack, it's a great topic, because what's happening now is, okay, what do you do now? I mean, we were talking about it before we started. What are you doing as your office? What am I doing with my office? What do I see our tenants? And I would just quickly tell you, I think the pendulum swung way too hard, and I knew it was. You heard everyone say, oh, what are you going to do? No one's going to need your office buildings anymore. What are you going to do? The future of work is everyone's going to be at home. And I'm like, not in my house. I don't know. I don't know about you, but I am not, first of all, my wife and kids would kick me out. I mean, I would have to find some place to shelter up, because I can't work from home. But I think everyone's quieted down now. And in the last few weeks, all those companies that we've been working with that have been saying, hey, we're staying out till next year, they're coming back. I think people are recognizing the value of good office space. So I would expect over the next several months, with protocols that make it safe, people will start coming back into work in an office. I think to keep culture, to collaborate, you're just going to need office space. I mean, I think we're seeing an uptick in activity and people that were putting everything on hold, saying, hey, we're ready to go now. So that's a really good sign for the economy and for companies and for businesses that they're seeing, hey, we're kind of used to this, and we see value in Zoom meetings and doing things virtually, but we're going to get back to an office. I do think that space will be different. I really do. I think, it'll be really interesting to see the future of offices, because, the trend for the last 10 years was to get rid of the traditional offices, have more collaborative space, workstations that were super small without barriers between you, right? I mean, most of the buildings we do now have all of the cubicles on the outside, have all the offices on the inside, and everything was going to cubes and collaborative spaces and alpha and beta bars to keep your people happy, all of this stuff where you're collaborating. I do think that will change a little bit, and people will think about, hey, we don't know the future of coronavirus, and we don't know when the next one's going to come. So we probably ought to be a little smarter about how we separate people. And I think that there's a lot of really good ideas on that we could talk about. But I'll be quiet for a minute, let you ask another question. But the point is a lot of change, a lot of chance for disruption and innovation. I think you see thought leaders out there that are really taking advantage of this time to say, okay, how do we come out the back end being the solution for people? And that's certainly what I've seen.
Mm-hmm. Look, I mean, we could just sit here and listen to this for the next 20 minutes or so. This is fantastic. Maybe unpacking a little bit of some of your points here. You mentioned, for example, off the bat, some of the stuff that Tina is now organizing at Crush the Curve. You're getting, I think you said, surveillance and maybe tracking a little bit down to a much more palatable number, let's say. Help us understand some of the initiatives that we can put in place to help employees feel comfortable to come back to the office, be it, tracking and symptom tracking or actual testing or new layouts. What's kind of state of the art here?
Yeah, so great question. And when people had these protocols to go back to work or school or whatever, they spent a lot of time talking about surveillance and tracking. And I think that was great. I don't want this to sound negative. I think it was really important to talk about, hey, when you come back, how are you going to track symptoms? How are you going to interact with your fellow employees? How are you going to keep yourself safe? All of those things were really good. But what we didn't spend enough time on was saying, okay, when it goes bad, right? When someone's sick or exposed you, what are you going to do as a company? What are you going to do as a college dorm? What are you going to do as a football team? And that part of it, we have been completely let down by our country, nationally, by the season. You come every level of leadership, there is millions of dollars out there to solve that question. And yet those solutions, that money has not hit us. So businesses have been left saying, gosh, what do I do? Do I start surveilling my people? Do I test people? Do I keep people that are vulnerable home? I mean, you just take our office for an example. We probably have 3 or 4 people that work here at our office that are vulnerable, right? So everyone else, they don't really care. If I get it, I'm going to probably be okay. But those people with comorbidities, they're vulnerable. So what do you do with them? So everyone's facing that. So I'm getting to the point. We have been working just desperately to try to solve that one question, which is when you're a company or a dorm or a school or whatever, how can you quickly test everyone so that you can find out if there's any positives? And it's going to be more important, Jack, when you get into October, November, when you have the flu, you have strep throat, you have the common cold, and you're going to have a bunch of people with symptoms that aren't COVID. How are you going to distinguish between COVID and non-COVID as we get through the next 6 to 8 to 10 months until you get a vaccine? It's going to be important to be able to pool tests and to be able to screen people for a price that doesn't cripple you as a company. Because at $100 a pop and with turnaround times of 7 or 8 or 9 days, you just can't, it's just not, it was never feasible. So what we're going to launch right now is basically you can put 20 samples into one vial and you screen. So for your company, you could screen every week, you could screen every 2 weeks, you could only screen when someone has symptoms. But the point is, you could just on your own, it's self-administered test, nasal, put the swab into one container, send that off to the lab. If that comes back positive, then everyone gets tested. But it's a really inexpensive way at $4 per person to just say, hey, do we have COVID in our office right now? That's revolutionary for this battle because no one's been able to do that. And so we're launching that this week. That's just one of the things we're doing because we'd like to get that in the hands. We have over 400 companies that have signed up with us to try to have us help them. And this will be the tool that will allow them to stay open because then they can surveil their people. And as the fall comes and the flu comes around, they can say, hey, is it COVID or is the flu? Is that, are we safe to be working here? And again, I want to be clear, it's to protect the vulnerable. I think this disease is not as bad as we thought it was. It's just not. But it's still, man, it wreaks havoc on a few people, and especially the elderly and the vulnerable and those people that have comorbidities. So we still have to be careful until we get through this.
So you said something right in there that I'd love to spend a little bit more time on. You mentioned that 400 companies have signed up with you guys to figure out how to manage this thing. First off, what's that cohort like? Is this, these tech businesses or these, or these factories or these, who's kind of really trying to move this forward? And then second, what does it mean to be, signed up? What kind of stuff are you helping them with besides the testing initiative? Yeah. What does that help unpack that a bit?
Yeah, so the great question. So what we did with all these companies that signed up with us is they needed protocols to get back to work, and then they needed help for when they needed testing. Again, let me just quickly tell you what we did at Crush the Curve, which I think is, hey, listen, we're working with all these states around the country for a reason. It's because we figured something out. The problem with testing for COVID, it should be illegal for anyone to do a test if you don't get the results back within 48 hours. And how many times have you heard someone say, well, I got tested and I waited 11 or 12 days to get the results? That's just the way it was. Well, Jack, traditional healthcare, which I've been a part of, it's just super slow in the way it reports. It just is. So you would have someone go into a traditional clinic, get a test result sent off to a lab somewhere, either here in Idaho or somewhere else. And then you had that test sit there. It had to go through the process. The result came back. Then it had to go to the patient. And that just it took time. I mean, you hear horror stories of families and people that have had, 10, 14-day turnaround times, or commonly 5, 6, 7 days. Well, at that point, you could argue, what's the worth of the test when you're out far enough that you could have quarantined yourself, right? So we've been working hard at that. So what Tina did, and I want to give her all the credit here. She comes from a tech background, not a healthcare background. And the way she viewed the world is, we've got a problem, and let's connect labs that have capacity with people that need testing in the most efficient way. So what we do at Crush the Curve is we have multiple labs that all have capacity that every day tell us what their capacity is electronically. And then we have people that need tests. And then what happens is the people that need tests say, hey, I need 25 tests or 100 tests at my company. Then it connects them to a lab with capacity. Then what we're doing is we're doing self-administered tests. So then the lab will send the kits to the company, FedEx overnight. They get the kits and they're all pre-labeled. So we already have all the employees in. So let's just say it's a meat packaging plant with 100 employees. They say, hey, we need to test our people because we've got a bunch of people sick that have COVID. They get the next day a FedEx package. They open it up. It's got all of the tubes barcoded. They self-administer the test, nasal swabs back in the kit, FedEx it back to the lab. We have just taken out of the middle of this thing a whole bunch of processes that were gumming things up. And then the interface, the tech, allows you to report right back to the company and the patient. So it's truly remarkable what's happened in a short time. It's required us to have capacity at the lab level, capacity at the collection kit level, and to bypass traditional pathways that are just cumbersome and difficult to navigate. And it's been really cool for companies because all of a sudden now but again, expensive. So the first problem we solved was, okay, how do you get tests quickly, and how do you connect capacity with people? That was easy, but those tests were, $80 each. So you have that company of 100 people at $80 a piece. That's just impossible. So that's why I'm so excited about this new surveillance thing, because we had to get the cost down, because one issue is capacity and turnaround times, but the next one is going to be surveillance, and how do we surveil as we get back to work.
Mm-hmm. So it's interesting to hear the use of the word surveil here, because I immediately get triggered to think think back to April or March when our governor in Utah initiated the like tracking anybody coming into the state thing, which freaked me out big time, right? I'm a big privacy advocate, and the idea of sending me a text, making me report and all that stuff. But I love to distinguish here that you're saying no, this is an actual test that we're doing everybody together to see
hey, it's a great point. That one word, I probably should stop using it, but medical surveillance is, hey, is the disease in your company, right? How do you screen it? And again, the screening that we're going to do is completely anonymous the first time. All we want to know with this first screening is, hey, out of all of these people in your office, is there anyone positive? Then the second step would be actually knowing who was positive. So, but boy, I've gotten in trouble a bunch of times because you bring that word up, and rightfully so, right? I mean, because during a pandemic, you got to have, what are our freedoms? What are we losing in order to fight this battle? And that word, boy, that's a trigger for a lot of people.
Makes me start thinking about, the NSA, maybe KGB or something.
That's right. It should.
That's awesome. With this group of companies that have signed up and are working with you, as you're kind of surveilling the scene, what kind of practices are they putting in place at the office or at their workspace to kind of minimize threat of spread? As you mentioned, you guys have a couple of people that might be higher risk. our portfolio companies certainly do. How should we think about office layouts, sanitizing stations, that kind of stuff?
Yeah, I think people have done a great job for months with that, right? So temperature screenings, symptom trackers, we partnered with Kinza thermometer. So it's a long story, but they do tracking and kind of predict outbreaks based on fevers. And so there's lots of great things that people are doing with protocols for cleaning and filters and air exchanges in buildings. So we went in and changed all of our buildings we own to increase the air circulation, changed the filters so that they filtered out COVID, did cleaning protocols with the right supplies, and tried to help with signage and the way that our tenants function within their office to help them with all that. So all of that's been great. And I think people have done a really good job. I think that was the easy part, if you will, but it still required compliance and people spending the money to do it, and putting in the right filters and the right protocols. But it was the easy part, right? Almost every business you walk in now, they're thoughtful. They're using hand sanitizer. They're keeping people. But the question has been the second question, which is, okay, now what happens when you get influenza going through your office in November? What happens when someone's got a kid at home with strep throat and they don't know it's strep throat and they come in and have a fever? That's the next level of this. Is as much as the prevention was important, what are we going to do for the treatment side when something happens? So, but I'm really proud of the people for the protocols that they put in place. And I think that's kind of old hat now. Most people have got that figured out. They've got that dialed in. Their next thing is, okay, now what? What do I do now, right? And the only other thing I'll tell you, Jack, is I'm shocked we had a spike this summer. I'm shocked. I listen, having been part of H1N1, when H1N1 was here in Boise, I was the medical director at Meridian, and we had tents in the parking lot. So I've been through these other pandemics that we've had, and we had the scare in the spring, and I just thought, hey, we're going to have all summer to get ready for the fall. We're going to have all summer to get our stuff together, to get everything where we need it to be for the fall when it really gets bad. And that didn't happen. We had this giant climb in cases, and now it's going down, thankfully. But I just didn't predict that in the summer where you're outside and just traditionally you usually have a decrease in disease. So I'm really worried. I don't know what, last spring, Crush the Curve, we tested 15,000 people to find out what the prevalence of COVID antibodies were in our state, and it was 1.7%. So now we didn't repeat that now, but I don't know what it is. But is it 10%? Maybe. Is it 15%? I don't know, but it's not very high. So now we're going into the fall where everyone's kind of tired of this. Everyone's tired of COVID, right? I mean, I am. We're kind of just over it, and everyone's going back to work, back to school, back to sports, back to everything. And you're not even in the heart of infectious disease season, right? Where you're going to have all these other illnesses. People are going to be in classrooms, indoors, cold weather. And it's going to be a tinderbox for problems, because you're going to have people that are confused. What is it? And you're going to have I will be shocked if we don't have another spike in COVID. Although I did read a scientific paper this week that has me questioning how bad it'll be, because we just don't know. But I think you're going to have another spike, and I just hope it's not very, very bad.
You bring up a really interesting point, and I'm going to relate it a little bit back to some of our portfolio. I remember in March and April, when we got the whole quarantine kind of lockdown situation, a couple of my portfolio company CEOs said they foresee a world where they just have their office shut down for broad swaths of time, and they reference last year in January, in kind of height of the flu season. They had a time when 17% of the office was sick and they were out, right? And his point was look, COVID's COVID and it'll come and go, but there's a case to be argued for doing something, just so people aren't getting sick. People aren't, they're happier and more productive, and maybe we're working from home every January. And how do you think, from your perspective, you also mentioned we're 5 or 6 months into this thing now, and people are starting to kind of think, well, maybe it's time to get back and really leaning into, maybe expansion plans again, even in the office. But how do flexible work, how do maybe potential, close downs in the holiday season or around, the height of flu season, how do you think that evolves the kind of commercial real estate space and office needs for people?
Yeah, it's a great question. One of the real unknowns is think about hygiene. Okay. infectious disease hygiene before COVID and after. I mean, we're different, right? Think about just the use of hand sanitizer and washing your hands and being aware of laughing and spitting all over someone when you're laughing. I mean, we're just more aware now. So I hope that we come out of this better, and that, infectious diseases, which come and go every year, maybe they won't be as bad now that we have better hygiene. I mean, that's the one thing that I think we probably will. I mean, influenza spreads the same way. Pertussis, all these other outbreaks we've had, they spread respiratory just like COVID. So maybe it's going to be lower. Maybe it's not going to be as bad of a problem. But I do think we're going to learn some lessons. That's the interesting thing about office. I think as the pendulum comes back and people say we need collaborative space, we need to be at work, we need to be together, because that's what I'm hearing all over. Because even from tech companies that are leading the way of saying, hey, we can work remotely, this is the future of work, they're even coming back to us and saying, hey, it's great, but we need to be back in an office. So I think you'll see thoughtful office plans that consider that we're probably going to have more infectious disease problems going forward. And that's why it's going to be interesting to see what happens with offices, with conference rooms, with collaborative spaces, with alpha and beta bars and spaces that allow for people to have their breaks and time to kind of mingle. I think it will be different. I don't have those answers yet, because it'll depend a little bit how this winter goes. I always tell people, I think we're probably at the bottom of the second inning now on this. We just don't know. Does this thing peter out and fizzle out? And, that's one thing. If it comes roaring back over the winter, it's probably another thing for us. But I do think work will change. Change is inevitable. But I'd always tell people, man, I believe in the American people, and I believe in entrepreneurialism. And we have some of the greatest minds in this country. We're going to react, and we're going to lead the way. And the future of work is bright here. And I think that companies will figure out corporate culture, how to deal with this new reality of, hey, this was a big deal we probably weren't ready for. But I don't know exactly how that will settle out into different industries in space. Because if I'm a law firm, I probably look different than if I'm a tech firm. I probably look different than if I'm a property management company. So it probably depends on what your interactions are at work. But it'll be different. It'll be different for sure. I think there's an argument to be made that the office spaces will get bigger. If you look at over the last 10 years, we had a lot less traditional office and a lot more collaborative spaces. So footprints were shrinking. I think those footprints will probably go back up, because you're probably going to have more space per employee and not be able to cram so many folks in cubes. But do I think some people will say, hey, we're just going to work from home, we're not going to go back to the office? Some, but not many. I think people are going to need space.
Mm-hmm. Gosh, what a fascinating perspective there. I mean, you can see a world where, look, I mean, frankly, a lot of people have looked at commercial real estate and thought, like, is this going to be a tough period for them? But to your point, people are starting to say, maybe we need to be back in for the collaboration. And that just means we need more space, right?
Yeah.
To unfit everybody. So I thought about it that way. That's fascinating. What do you think changes with a vaccine, if and when that ever comes?
Oh, I wish you would have asked me this. This is one of my pet peeves. I am sick and tired of medical professionals, like on my side of the thing, right? So a lot of people that are super smart, and you've heard them, they completely dog people that have had this disease. They say antibodies don't mean anything, right? Hey, if you get this illness, it doesn't mean anything because we don't know what antibodies are going to do. We don't think that you're going to get immunity after you have COVID. I mean, that's what you hear. I've been yelled at. I've been on some forums with other doctors, and I've said, wait a minute. Now, usually when you get a virus or you get sick, it means that you get some immunity from it. Why are you thinking this time is going to be different, right? And they've fought me, and I think their argument was, hey, you don't know that yet, so don't tell people that, because you don't want them to, like, hey, I had it, so I've got a big Superman on my chest, and now I can go out and I don't have to be careful. But those same people, Jack, have now got to pivot to a narrative of this vaccine is going to work for everyone. Go get the vaccine. And this vaccine is going to be the best thing ever. I don't know how they do that. I don't. Because they've been telling us for a year now that getting the disease doesn't give you antibodies or it's not good. Okay, now they're going to make this moral argument that if you don't get a vaccine, you're a bad human. And so I don't know what they're going to do. Here's what I think. I think that if you get COVID, it does mean something. Antibodies do mean something. I think that a vaccine is going to help. And I've always thought that. So we don't know how long when you get a vaccine, it's going to give you the right antibodies to help fight this off again. We don't know if it's going to mutate. I mean, we just don't know yet. And the virus is new enough that we don't know season to season if it comes back mutated and there's another, and how much immunity you'll have. But I do think the vaccine will help. I'm going to take it. I think it's part of the solution to get us back. And but I've also been saying all along that if you get COVID, it's a good thing. If you get it and recover, then you probably have some immunity. So I'm excited for it to come. And you hear lots of reports. There's so much politicizing of the vaccine. I don't know when it will come. I read every day different opinions, but I know they're working hard. I will remind everyone, when I was up at the University of Washington's virology department with really, really, really smart people, this was in April, Dr. Alex Gehringer said to me, in the history of the world, we've never had a vaccine to a coronavirus. They're just really hard to do. So just remember, this is a really, really hard thing to do. But then his next breath was, hey, but in the history of the world, there's never been more money thrown at a problem, right? So he said, hey, I think we'll get one, but it's going to be hard. It's just hard to do vaccines, especially for coronaviruses. So, but it will come, and I think it will help us. And I think it will, if anything, it'll also give a giant breath of hope to the country that, hey, this thing's, there's an end, because everyone's been told forever, the vaccine's the solution. The vaccine's the solution. So I think we need that. We need the vaccine. We need to get it out, and it will help us.
I love that. It's interesting to hear all the people you're interfacing with, all the initiatives you have going on. For somebody like me and maybe some of our audience today, it's a little bit daunting to think about, well, what part do I play in this, right? How can I help out? How can I mobilize some of my meager resources and be a benefit here? So for the audience, what can anybody listening do to get involved?
Stay informed. There's so much misinformation. I think we need really good people that actually look at science, kind of sift through the politics, stay calm. All right. I mean, we're going to get through this. If anyone went through the last recession, there were a lot of unknowns with that one that we didn't control. This is a virus. It will go away. It's going to get figured out. We shouldn't overreact either way. Masks are good in the right situation. Vaccines are good. They won't be perfect. But I think stay informed and be a voice of reason in a time when everything is just so politicized. There is still truth in the world.
I love that. Well, look, we're winding down to a close here. This has been fantastic. And maybe with our last 30 seconds or minute or so, you've got all these big facelift projects you've done for the Treasure Valley. What's next on the plate? What else should we be anticipating?
We've got a lot going on at 10 Mile on the freeway. We got a lot going on at Eagle View Landing with several new buildings downtown. We've got another big building we've proposed. So we'll continue doing commercial development. We're really excited with the Salzer Health stuff. We have to lower costs for people in Idaho for healthcare. And I'm super excited about Salzer transparency. I'm a big believer that if we can get patients in their hand transparency of cost and provide quality of care, that we can bring that down. So we've got a lot going on, but it's all good stuff. And I just love every day you come to work here. I'm surrounded by people that are just motivated to go change the world. And it's really fun to be part of what's happening.
Tommy, this is fantastic. Thank you so much for your time and for your ongoing support of Idaho in general. It's such a privilege to have you with us today. So thank you again to
Thanks,
Thanks for tuning in, and you can find Tommy on his LinkedIn profile.